The next case is probably one of the hardest things to do in dentistry, and this is kind of a mundane case, but I kind of want to highlight how challenging this is. Putting a crown on a front tooth. So this is a 29-year-old female. I'm not sure the pre-treatment image is going to really demonstrate exactly what the problem was, but she had an accident. There was trauma to her front tooth, pushed inward. See somewhat that it's longer. She developed a condition, what's called internal resorption, where secondary to the trauma, the tooth started eating itself away from the inside out. She came to me in a lot of pain. We referred her off to the root canal specialist. The root canal was done on the tooth to stop the internal resorption. But afterwards, we started deciding what to do with the tooth. Based on the positional challenges, we talked about all the different restorative options for her. She elected she wanted to have a crown placed on that tooth, which becomes a bit of a challenge because we'd like to limit our scope of treatment as best we can. We only want to put a crown on one tooth and not on both teeth to limit our scope of treatment. Now, trying to get a match to two teeth side by side can be a bit challenging. So what we ended up doing was, fortunately, I think you met Irwan. He's my lab technician. He did my veneers. So he came into my office after he had done the crown, and this was sort of what he first came up with. So we put it in and we sort of evaluated. I think it's too light. I think the shape of it is a bit off. And one of the things I really didn't like was that there was this dark space right here on this side of this tooth. So I said, look, let's make it wider. Let's try to make this. I thought that we had a really good match around at the gum line, but as we moved sort of up towards the tooth and here, I don't think we captured the change in the adjacent tooth. So we went back to the lab, we had several iterations, and I got him to close the contact. We didn't like this. This tooth is smaller than this tooth, so the crown is now wider, and it doesn't look all that great. When teeth are side by side with each other, you really get that comparison, and you can sort of see the differences between the two. And so we thought this tooth was going to be too wide. So we took it off, we shaved it down a bit, we added some staining to it, and this is what we ended up coming up with. So we really captured what was going on the incisal edge of the tooth. So here, I think we got a really good shape. But we still left with the negative spacing here. I didn't have a chance to put the final photos in here, but what we ultimately had her do was come back a few weeks later, and I added some filling material to this tooth to sort of close it up, and we got a really great aesthetic result, and we were super happy.